So I have a general process by which I work with everyone. However, there's always unique individual differences and needs and challenges or health goals that we need to address. So I always start with, every time I start working with someone new, our kickoff session or intake session lasts at least 75 to 90 minutes because we're going through their whole health history, tying together things that maybe they didn't think were important, things they didn't think could go together, incorporating any labs they've already had done, and then that's when we start to determine kind of the foundational nutrition, lifestyle, supplement plans, get the labs ordered, and then we're off to the races, because after the data starts coming in, we can just continue to build on that based on how they're feeling, what their lab data is showing us, and the speed by which they want to and are able to start implementing changes. And what I call just layering in shifts, because I don't want it to be a massive overhaul. I want to layer in a couple shifts that feel totally doable. And then once those are second nature, we just continue to layer that on. And that's why I work with women primarily in a 6-month program so that we have the time and space to do that.